I think it's really rewarding to be able to take what used to be a potential death sentence, right, in terms of cirrhosis, liver failure, liver cancer, and easily treat it with something for 2 or 3 months that they might not have a single side effect to. I think it's really rewarding to watch that happen, and patients seem quite happy with it too. Years ago, before I came to Sunrise, I was in private practice and I used to treat patients with hepatitis C. The state made that very difficult to do for a while, and they had rules in place which meant you had to treat in conjunction with the GI doctor, which by the time you would consult them, they would just want to take over and they wouldn't do anything with you. So essentially we had to stop treating hepatitis C ourselves. Right before I came to Sunrise, that rule changed. So when I came here, I decided to start treating patients here for hepatitis C.
Being able to provide Hep C in-house through the same physicians that are also providing them their prescribed medications and monitoring their medical conditions really allows those patients to get a holistic approach to their care. Oftentimes, our patients struggle with getting in with external providers, or they struggle with managing schedules and setting up appointments, or maybe they have transportation issues or technology challenges. So being able to offer that service while they're getting our additional treatment is a huge asset for a lot of our patients.
On an intake, we'll check blood work to see if someone has antibodies against hepatitis C. If they have antibodies, we'll then do further testing to see if they still have virus, and if they have virus, what the genotype is, essentially what's the subtype of hepatitis C that they have. So once we have all that, then we'll have a conversation with the patient about whether or not to treat them. And there are a lot of things that go into play. I mean, first of all, they have to want to be treated. They also have to be ready to be treated. There used to be a lot of rules about who can be ready and when they can be ready. Those rules are gone now, and the state wants us to use our better judgment. And probably the biggest thing we consider is whether or not there's any kind of risk for reinfection, whether or not there's any continued IV use. If there is, then we need to hold off for a bit until the patient's ready. Once we determine a patient is appropriate for treatment, we'll get additional blood work. We do this additional blood work instead of getting an ultrasound because it's easier. We can get it all done in-house, and we have all the results within a week. And then the patient will meet with one of the doctors or a nurse practitioner who is seeing the patient on the doctor's behalf, and we will talk about treatment with them. And so far, we've not had any treatment failures. And you probably wouldn't expect to find a treatment failure. The treatment failures are typically found in more complex histories. People who have had multiple failures previously, or people who are on other medications, people for things like HIV, or people that have hepatitis B, or people who are already in liver failure. And those patients are so complicated, they really need to see somebody else. So while theoretically the overall the success rate should be at least 98%, it's probably closer to 100% in our population. But so far, we haven't had a single treatment failure in over 100 patients that I'm aware of.
So any one of our patients that are currently in treatment with us for substance use disorders, if they have hepatitis C as a condition or a concern, all they have to do is speak with their counselor or their medical provider about it. Our counselors know the program exists, and so they often will bring it up with a patient if a patient hasn't done so as well. So it's very simple for one of our patients to start hepatitis C treatment with any of our medical staff.